age plus sight plus relation to the tooth plus radiographic patterns plus signature clue. This is the fastest NEET MDS way. Let's simplify odontogenic tumors. First, log the three major benign groups. Epithelial, think ameloblastoma, AOT, CEOT, squamous odontogenic tumor. Mixed, think odontoma, ameloblastic fibroma, odontogenic ghost cell tumor. Mesenchymal or ectomesenchymal, think odontogenic myxoma, odontogenic fibroma, cementoblastoma. Mnemonic, EMM, epithelial, mixed, mesenchyme. That simple split already reduces the panic. Next, the superlatives you must know. Most common odontogenic tumor overall, odontoma. Most common true odontogenic neoplasm, ameloblastoma. Most common benign but locally aggressive odontogenic tumor, ameloblastoma. Statpearls notes that odontoma is the most common odontogenic tumor and is generally regarded as a hematoma rather than a true tumor, while ameloblastoma is second most common after odontoma and is the most important true neoplasm exam-wise. Memory, odontoma is commonest, ameloblastoma is commonest true one. Next, the master diagnostic algorithm. If it is radio-opaque tooth-like lesion in a child or a teen, think odontoma. If it is soap bubble multilocular posterior mandibular radiolucency, think ameloblastoma. If it is around an uninterrupted canine in a young patient, especially the anterior maxilla, think AOT. If it has calcifications plus amyloid or Lissegang rings, think CEOT or a Pinbock tumor. If it has right angle or step ladder trabeculae, think odontogenic myxoma. If it is fused to the tooth root with a radiolucent rim, think cementoblastoma. That one framework solves most MCQs. Next, tumor by tumor exam shortcuts. Ameloblastoma, classic clues, posterior mandible, 20 to 40 years, soap bubble or multilocular, root resorption, locally aggressive, recurs if treated inadequately. Memory, ameloblastoma is equal to adult posterior mandible plus soap bubbles. Ameloblastoma is much more common in the mandible, especially the posterior mandible, and imaging often shows a multilocular or a soap bubble radiolucency with expansion and root resorption. It behaves as a benign but locally aggressive lesion with a significant recurrence risk. Adenomatoid odontogenic tumor or the AOT. Classic clues, second decade, often females, anterior maxilla, associated with unerupted tooth, usually canines, well circumscribed, encapsulated, behaves like a hematoma or a non-aggressive lesion. Memory, AOT is equal to adolescent, anterior, around the impacted canine. Statpearls describes AOT as usually diagnosed in the second decade, often in the anterior maxilla, commonly as a well circumscribed unilocular lesion around an unerupted tooth, usually a canine, and biologically non-aggressive. Odontoma, two must-know forms. Compound odontoma looks like mini teeth or toothlets, usually in the anterior maxilla. Complex odontoma, irregular radio-opaque mass, more often the posterior maxilla or the mandible. Memory, compound is equal to cute little teeth. Complex is equal to confused calcified lump. Odontoma is the commonest odontogenic tumor, usually seen in the first or the second decade. Compound odontoma shows multiple tooth-like structures, whereas complex odontomas are an irregular radio-opaque mass. Compound lesions are most often in the anterior maxilla, while complex lesions more often involve the posterior jaws. Calcifying epithelial odontogenic tumor, CEOT, or the Pinbock tumor. Classic clues, rare, more often mandible, 30 to 50 years, maybe around an impacted tooth, radiolucency with flecks of radio opacity. Histology, amyloid-like material plus Lissegang rings. Memory, PIN-BOB is equal to pink protein plus rings. Stackpole notes that CEOT is rare, usually involves the mandible, often in the adults around 30 to 50 years, may be associated with an impacted tooth and histologically shows amyloid-like material with calcifications forming the Lissegang rings. Odontogenic myxoma. Classic clues: mesenchymal, aggressive intraosseous lesion, uni or multilocular radiolucency, thin trabeculae at right angles, step ladder or tennis racket type pattern. It is not encapsulated, so more invasive. Memory, myxoma is equal to myxoid multilocular step ladder. Odontogenic myxoma is an aggressive intraosseous ectomesenchymal tumor. Radiographically, it may be uni or multilocular, thin trabeculae arranged at right angles, which can create the classic step ladder appearance. Cementoblastoma. Classic clues: true cementum tumor attached to the root, usually the molar or the premolar region, more often the mandible, painful swellings, radio-opaque mass with thin radiolucent rims, may cause root resorption. Memory, cementoblastoma is equal to cement stuck to the root. Stackpoles describe cementoblastoma as a rare, benign mesenchymal tumor that grows in continuity with the apical cemental layers of the molar or the premolar teeth, often in the mandible, and radiographically appears as a radio-opaque lesion with a thin radiolucent rim. Ameloblastic fibroma. Classic clues: young patient, average is around 14 years, posterior mandible, mixed epithelial and mesenchymal tumor, usually unilocular or multilocular radiolucencies. Memory, fibroma in a young jaw, think ameloblastic fibroma. Ameloblastic fibroma is a true mixed neoplasm, tends to affect the younger patients and commonly occurs in the posterior mandible. Recurrent lesions matter because some can progress towards ameloblastic fibrosarcoma. Odontogenic ghost cell tumor. Classic clues: ghost cells may show calcifications, often well circumscribed, can be associated with unerupted canines. Memory, ghost cell is equal to ghost cell tumor. The ghost cell group is uncommon but highly important because ghost cells are such a distinctive histological clue. Next, the 6 exam traps students keep making. Trap number 1, confusing odontoma with ameloblastoma. Fix: odontoma is radio-opaque and tooth-forming. Ameloblastoma is radiolucent and aggressive. Trap number 2, missing AOT around an impacted canine. Fix: young patients plus anterior maxilla plus unerupted canine is equal to AOT first. Trap number 3, forgetting the root attachment of cementoblastoma. Fix: it is fused to the root, think cementoblastoma. Trap number 4, mixing CEOT and ghost cell tumor. Fix: amyloid plus Lissegang rings is equal to CEOT. Ghost cells is equal to ghost cell tumor. Trap number 5, ignoring the age. Fix: teen is equal to AOT or odontoma or ameloblastic fibroma is more likely. Adult posterior mandible, ameloblastoma is more likely. Next, ignoring the behavior. Fix: ameloblastoma and myxoma are the big, don't underestimate me tumors. The best oral chant for revision: odontoma, commonest. Ameloblastoma, commonest true one. Soap bubbles posterior mandible is equal to ameloblastoma. Adolescent anterior maxilla around the impacted canine is equal to AOT. Amyloid rings is equal to PIN-BOB. Step ladder trabeculae is equal to myxoma. Root fused radio-opaque mass is equal to cementoblastoma. Young posterior mandible mixed tumor is equal to ameloblastic fibroma. This is the kind of chant that sticks in the exam hall. Hope that helps. Don't forget to save it. Don't forget to share it. Let everyone benefit. Take care.